Hi, I'm Dr. Andrew McParland, and I'm here to explain the Dutch hormone test. Dutch stands for Dried Urine Test for Comprehensive Hormones. This test may be useful for evaluating chronic stress, looking at sleep disturbances, low energy. For our male patients, the Dutch test can be indicated for low libido, erectile dysfunction, hair loss, weight gain, low mood, irritability, or low muscle mass or loss of bone mass. For our female patients, the Dutch test can be indicated for fertility issues. It can also be helpful for painful or irregular menstrual cycles, PMS symptoms, hair loss, weight gain, mood disturbances, or low energy. The Dutch test is the test of choice for evaluating females who have already had their hormones analyzed and are taking some form of hormone replacement therapy. This can be very important in the management of that medication to ensure that you're getting the proper treatment. So you've just finished your appointment with your naturopathic doctor, and they've suggested that you do the Dutch test kit. You'll come out to the front desk and you'll receive a testing kit that looks something like this. If we open it up, we'll find that the Dutch test kit has information on how to do the collection in terms of what medications you should avoid. In general, avoiding oral hormone medication, including DHEA, estrogen, or pregnenolone is important to avoid, but always follow the recommendations of your naturopathic physician. It is important to note that unless otherwise instructed, do not skip any doses of oral contraceptive medication. In terms of dietary advice to follow before doing the Dutch test kit, you should avoid eating avocado, bananas, and fava beans for 48 hours prior to testing, as this may impact results. It is also important to note that no alcohol or caffeine, including coffee or caffeinated teas, should be consumed on the days of testing. It is also important to note that you need to limit your total fluid intake to 40 ounces or about 1 liter of fluid in total during the testing period, and this is to avoid having a more dilute sample, which will affect analysis. The test kit includes a requisition form, and this requisition form has patient information up at the top, as well as information on collection times that need to be filled out by the patient. For our female patients, you will also need to note some information about your menstrual cycle, including the date of the first day of your last menses. On the back also includes information that must be filled out by the patient and is mostly involved with taking medical history, including what symptoms you may be experiencing and what medications you may or may not be taking. The Dutch test kit involves 5 sample cards and corresponds to the times listed on the right-hand side of the requisition form here. Information on time of day of testing can also be found inside the Dutch test kit here and correspond to the information provided on these sample cards inside the Ziploc plastic bag. These sample cards must be filled out with your patient information, including name, date of birth, date of collection, day of the cycle for our female patients, and the time of collection. You can see sample information that pertains to each card in particular listed up at the top. When it comes time for your first sample, open the Ziploc bag and take out one of the collection cards. This is one of 5 sample cards located inside the Ziploc plastic bag. Once you open it up, underneath the patient information, you'll see filter paper, which is used to collect your urine sample. You can urinate directly onto the sample strip, or you can urinate into a clean cup and then dip the sample card into the urine. You must ensure that the sample card is not oversaturated with urine and it does not go up too high on the filter card. Once you have dipped or urinated on the sample, you must leave the sample card out to dry for a 24-hour period. Continue this process with all 4 sample cards until all have dried for a minimum of 24 hours. Once the cards have dried, you can refold them, return them to the Ziploc plastic bag, and return your test kit to Crossroads. Crossroads will provide the shipping and send the samples off for analysis, and we will be sure to contact you once the results are in.